A multidisciplinary approach to your dentistry is oftentimes needed in order to achieve the best long-term treatment outcomes. Doctors Matthew Nawrocki and Richard Aguila with Jacksonville Dental Specialists are here today as part of our weekly Dental Health Watch segment to discuss how their specialties of prosthodontics and periodontics come together to achieve long-term results. Okay, before we go, we have got to define, in layman terms, what are periodontics and prosthodontics? I mean, it's even hard to say. So why don't you guys give it, for people who aren't familiar with those specialties, what does that mean?
So basically, a prosthodontist and a periodontist, we're specialists, just like your orthodontist specializes in moving teeth with braces. A prosthodontist is someone who, after dental school, went to residency. I went through 4 years of residency after dental school, specializing in either the restoration or replacement of teeth.
Okay, and let's kind of go from there, because you guys specialize in a lot of things, but one thing that you do and do very well at crowns and veneers. And you see sometimes when this is done, when it's done someplace else, there's a lot of damage, not only to the teeth, but also to the gums. So let's kind of go down this road and talk about, for people who have not had this done or have had these procedures done, restoration, veneer, crowns, what they need to be on the lookout for.
Oftentimes, if someone has had a lot of restorations, crowns, veneers, even fillings, things like that, even if it's just recently done, if the gums haven't been respected, the health of the gum tissue hasn't been respected, their gums are painful, they're red, they start to get black lines around where their restorations and their gums meet. And if this junction is not respected, where the restoration and the gums meet, it can lead to a lot of costly treatments, retreatments, pain, discomfort, aesthetic. It's not aesthetic in appearance. So this is an area that we as specialists in particular, we get a lot of patients who even just have had recent restorations, and they say, why are they hurting? Why are they breaking down? It's not right. What's going on?
I paid to get this fixed.
Exactly.
Especially I wanted a nice aesthetic look to it, and now all of a sudden it's red and my gums are hurting.
So, and Dr. Aguila can elaborate a little bit more on this, but basically it's not just a restoration on the tooth. You have to take into consideration the health of the gum tissues as well. You want a nice foundation for a nice house.
That's a good analogy to use.
Yes, periodontics actually literally means around the tooth, and that's what my specialty deals with. Treatment and diagnosis of diseases that affect the surrounding bone and gum tissue around the teeth. So the longevity of any restoration is highly dependent on the support of the gums and the tooth. So this inflammation that's present deals with a concept called biologic width. And biologic width deals with the placement of the margin of a restoration in relation to the surrounding gum and bone tissue. And when we talk about margin, the margin is the overlap between where the crown, veneer, or restoration stops and meets the tooth. Okay, and that picture just showed if there's a biologic width of 3 millimeters that's needed, and if the restoration violates this 3 millimeter distance, what you typically get is inflammation of the gums. You have swollen gums, bleeding gums, painful gums, and it also affects the bone, so you get bone loss. So this is a negative outcome, and this is something that we don't like to see. And here's a clinical picture.
You see this a lot with people who have gotten restoration and veneers and whatnot in other places?
They come in, they saw their general dentist, and they have a lot of inflammation, and they come see me because their gums are hurting.
They're wondering why. And why is this happening?
That relationship, the health of the gums wasn't respected, and to fix it, it's not just a gum issue. Oftentimes the restorations have to be cut off, redone, because as Dr. Aguila makes the tissue healthy, the restoration now no longer conforms to where the gums are. So oftentimes to fix the problem is much more costly, timely than if it was assessed correctly in the beginning. Leading to a lot of frustration, understandably.
Can I stop you for a second? Can you kind of tell us the difference between a restoration, a veneer, and a crown? Just kind of quickly, what is a restoration?
A restoration meaning anything we do on a tooth, maybe a bonding, a restoration like a crown or veneer where it goes to a lab, it's some porcelain, it's still a restoration. So any kind of, if you had a reconstruction or cosmetics, veneers, maybe your teeth were broken down more and they needed crowns, or you got, you're in a bridge or something. So any time where you have a man-made restoration meeting the gum tissue, meeting the body. There's an opportunity for inflammation there.
Which is why it is so important to go see specialists so that you don't go down this road, obviously, with your gums and whatnot. So let's take it a step further now, because we've talked about the importance of making sure that it is done properly so that it doesn't damage the gums. What about the tooth? You've seen a lot of people come into your office, and not only is it not functional, it's not aesthetically pleasing when it's not done correctly. And you know, I've seen people that have teeth that look really long. You know, and some people say it looks a little bit like a beaver or whatnot because it wasn't done properly.
Exactly. And so as the teeth wear, your body oftentimes compensates, but sometimes the body can't compensate it too quickly. If this is not correctly identified and restored, like crowns or veneers are just thrown on there, the result can often not be aesthetically pleasing. It can affect your speech. It can increase breakdown and wear. And so you see someone smile and they look long in the tooth. You see all bottom teeth and no top teeth. You see all gums on the bottom, no top teeth. And like this picture shows right here, if that was not identified correctly and the gums brought down instead of the tooth brought up, the result would not be pleasing. It would not work out. So it's very much a team approach. The prosthodontist, the periodontist, oftentimes the orthodontist as well if you need root canals. But you know, it's very much a team approach. It's not a jack of all trades type things, and that's how we get the best outcomes.
Yeah, Dr. Aguila, it really is. I mean, it's not something a one-stop shop. You need to make sure that you have, such as yourself, two specialists who can really do it right.
Yes. And the biggest advantage of having specialists doing your care is just the level of training and expertise. I mean, as we stated, we both did, you know, additional residencies where that's all we did. We diagnosed and treated the most complex dental treatment that patients need. And by us working as a team, we not only look at the tooth, we look at the big picture. We look at the prognosis of the teeth. We look at not only the short term, but the long term. You know, we work together where we can identify which teeth need to be removed because they have a bad prognosis, or which teeth can be saved. If there are teeth that are missing, we can identify if implants are possible. So we kind of work together as a team, and I believe we have a couple cases here that kind of demonstrate some of the teamwork that we do.
Yeah, we were showing some of the pictures a second ago, but unfortunately we've run out of time, and we appreciate both of you coming in, Dr. Aguila, Dr. Nawrocki. We appreciate your expertise as always, and thank you so much to Jacksonville Dental Specialists for coming on and sponsoring this segment. If you would like to schedule an appointment today, it's very easy to do. All you have to do is dial the number there on your screen, 904-460-4201. You can get a consultation. You can also visit their website to learn more information at Nawrocki DMD.com or Aguila DDS.com. And again, both of those websites are right there on your screen, and the number 460-4201.